this is Dr. Shah from Next Health, and today we're doing the PRP procedure on Dr. Mona Van, who's volunteered to be our patient today. Ross is going to be drawing 2 tubes of blood. We use the special blood draw tubes here, which have a separator gel inside to help separate the platelet portion of the plasma from the blood when we centrifuge it. And so Mona's going to get her blood drawn. Normally we do 1 tube if you're doing your face and 1 tube if you're doing your scalp, and Mona's going to be doing both areas today. So we're using the tiniest needle possible to draw blood from the arm, and it doesn't hurt too bad when it goes in, and once it's in we just automatically insert the tubes and we just kind of wait for a little while the blood flows into our special tube here.
Let's get an air in there. Alright, so
now we have the tubes inside the centrifuge machine. It's going to spin for about 10 minutes. And what spinning the tubes does is it allows the heavier elements in the blood to settle to the bottom of the tube, and the lighter elements go up to the top. And the lighter elements is that platelet-rich portion that we talk about. That part of the blood actually has all the growth factors in it. The growth factors are what's really helpful to growing hair, to growing new skin cells. There's actually 8 different growth factors that are in that super concentrated mix of platelets up top. We're going to separate that out, and we're going to put that into a syringe and inject them into the areas that we want them to go to. All right, so we're getting ready to inject Mona's scalp right now. And the first thing we're going to do is we're going to numb it a little bit with this benzocaine. And I'm going to put some benzocaine on her scalp. We'll sit there for a little bit and cause it to numb, especially in the areas that we're going to be injecting. And what Ross is doing here is he's taking the plasma portion into these syringes so that I can inject it. So Mona, you can just go and lay your head back and just relax. And I'm going to do a little bit of... It's going to be a little tingly. All right, thank you, Ross. So here we go. We're going to inject the platelet-rich plasma into her scalp. We use one of the tiniest needles available. This is basically a Botox needle. It's a 30 gauge needle. You should barely be able to feel this, okay, Mona, especially with the numbing in there. And what I'm going to do is I'm just going to inject this plasma right underneath her scalp. Here we go, 1, 2, 3. Right at the base of the hair follicles, where all the follicles are, right under the skin. And what this does is it brings those growth factors right to where we want them. We want them to be right underneath the follicles so that, for example, the endothelial-derived growth factor can encourage the blood vessels to grow and bring more blood there. There's insulin-like growth factor, which increases cellular reproduction. All right? Mm-hmm. Okay, we're all done, Mona. You did great.
Thank you. It wasn't that bad. I thought it was going to be worse.
Awesome. It only took like 5 minutes, 10 minutes, right?
Yeah, that was, the whole process is so fast. It's crazy. Quick question.
Sure.
Can I work out tomorrow morning?
Yeah, sure. You can work out tomorrow morning.
Okay.
You want to, you don't want to work out after this treatment, of course. You're increasing blood flow, and we just put a lot of little injections into your head. But tomorrow morning should be fine.
Okay. And then how often should I be getting this?
So we always recommend doing them about a month apart, and initially we recommend 3 treatments for sure, so 3 months in a row, and then we kind of see how you're doing, and if it's going well and you really like it, we can do more.
Okay.
But usually we wait a month in between each treatment.
I mean, it's so easy and convenient, like it's not a problem to come in once a month and do it.
Yeah.
And I always thought this process would be way more complicated.
Yeah, it's a lot easier than people think, and it's from what I've seen and all of our patients have seen, they've been really, really happy with it. So, so you do it in combination with, like we talked about, diet and other correcting other hormone and micronutrient problems, and all those things together come together really nicely, and you should see some good thickening of your hair the next few months.
I'm insanely excited. Thank you.
You're so welcome. Okay, let's move on to the next part. The next part is your face microneedling. So Ross is going to take over and do that part.